Hello everyone. In this video, I will discuss two of the most prescribed statin agents, Lipitor or atorvastatin and Crestor rosuvastatin. Atorvastatin, brand name Lipitor. This medication was initially approved by the US FDA in 1996 and currently indicated to treat adults and pediatric patients aged 10 years and older with heterozygous or homozygous familial hypercholesterolemia, as well as for the prevention of atherosclerotic cardiovascular disease. This is a synthetic lipid-lowering statin agent. Chemically, it contains a pure hydrocyclic ring in the middle, perfluorine phenol, amide, and secondary alcohol, and also the carboxylic acid motif. This medication is available as tablets, 10 mg, 20 mg, 40 mg, and 80 mg. So that's the strength of the tablets. Recommended dosing, starting adult dose, is 10 or 20 mg, taken orally once daily. The dosing range is 10 mg to 80 mg once daily. For patients requiring over 45% reduction of LDL cholesterol, the starting dose is 40 mg. Molecular weight for this medication is 558.64 grams per mole, and hydrogen bond acceptor 7. Hydrogen bond acceptor refers to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor is 4, and hydrogen bond donor refers to the number of hydroxy and also the NH groups within the drug molecule. Log P 3.85, polar surface area is 112 square angstrom. Given the drug molecule contains carboxylic acid motif, so therefore this medication is actually available as the salt form with the calcium. So there are two drug molecules and they have this calcium salt form along with trihydrates. Mechanistically, this medication works as a selective competitive HMG-CoA reductase inhibitor, and this enzyme involves in the early stage also a rate-limiting step in the hepatic biosynthetic pathway of cholesterol. Pharmacokinetically, absorption rapid. Volume of distribution is about 381 liter. Protein binding is greater than and equal to 98%. Metabolism, and this medication is a substrate of CYP3A4, this enzyme. So the metabolic sites, so would it be the 4-hydroxy group or the 2-hydroxy? So that's the active metabolites by the CYP3A4. Bioavailability is about 14% for the parent drug molecule, about 30% for the overall the HMG-CoA inhibitory activity. So including the metabolites. Tmax 1 to 2 hours, half-life about 14 hours for the parent drug molecule, 20 to 30 hours for equally potent metabolites. Excretion, so predominantly in the bile, in the urine, so it would be less than 2% excreted in the urine. Drug-drug interactions may increase the risk of myopathy and rhabdomyolysis of Lipitor. As mentioned, given this drug molecule, it's substrates of CYP3A4, so therefore patients, if they also need to take some other medication, if they are CYP3A4 and transport inhibitors, for example, cyclosporine, the immune suppressants, or select antiviral proteins inhibitors. Avoid concomitant use with atorvastatin. Otherwise, this would lead to increased drug exposure for atorvastatin, can lead to increased risk of myopathy and rhabdomyolysis. For patients, if they take some other, for example, macrolide antibiotics, clarithromycin, azole antifungals, itraconazole, and select antiviral proteins inhibitors, do not exceed 20 or 40 milligram atorvastatin daily. So therefore, you have to lower the dose accordingly, try to mitigate the risk for myopathy and rhabdomyolysis. So for detailed drug-drug interactions, please refer to prescribing information for details. Adverse effects, at least 5%, nasopharyngitis, pain in extremity, arthralgia, diarrhea, and urinary tract infections. Rosuvastatin, brand name Crestor. This medication was initially approved by the US FDA in 2003 and currently indicated to treat adults and pediatric patients aged 7 years and older with heterozygous and homozygous familial hypercholesterolemia, as well as for the prevention of cardiovascular disease. Similar to atorvastatin, and this is a synthetic lipid lowering statin, chemically contains a pyrimidine heterocyclic ring motif in the middle within the drug molecule. Similar to atorvastatin, this rosuvastatin also contains the same parafluorine phenol motif, sulfonamide, secondary alcohol, and also the carboxylic acid. This medication is available as a tablet, 5 milligram, 10 milligram, 20 milligram, 40 milligram. So that's the strength of the tablets. And because of the rosuvastatin is more potent compared to atorvastatin, so therefore, if we look at the dose range, you can see it's a lower dose, 5 to 40 milligram, taken orally once daily, with or without food. Molecular weight for this medication 481.54 gram per mole, hydrogen bond acceptor 9, hydrogen bond donor 3 log P, so it's 0.89, and it has a lower log P, so therefore it's more hydrophilic. Polar surface area is 149 square angstrom. Mechanistically, very similar to atorvastatin, can work as a selective competitive HMG-CoA reductase inhibitor by targeting a rate-limiting step in the hepatic biosynthetic pathway of cholesterol. Pharmacokinetically, Tmax 3 to 5 hours, volume of distribution is 134 liter. Protein binding 88%, metabolism, and this is a subject for CYP2C9, so it's about 10% will be metabolized by CYP2C9, this medication. Bioavailability is about 20%, half-life approximately 19 hours. Excretion in the feces about 90%, so mostly as a parent's drug molecule. Drug-drug interactions may increase the risk of myopathy and rhabdomyolysis for rosuvastatin. Given rosuvastatin is a subject of CYP2C9 and also the transporter protein, so therefore the patients, if they take transporter protein, for example, OATP1B1, and like cyclosporine and gemfibrozil, and also some other anti-HIV HCV proteins inhibitors, if they are, so they are CYP2C9 inhibitors, So therefore, this would increase the drug exposure for rosuvastatin. So the intervention strategy would be avoid concomitant use with rosuvastatin, or in some other cases, they adjust the dose accordingly and do not exceed, for example, 5 or 10 milligram rosuvastatin once daily. Adverse effects: at least 2% headache, nausea, myalgia, and asthenia, constipation. So now if we take a look, kind of direct comparison between Lipitor, atorvastatin, and Crestor, rosuvastatin. As mentioned, both statin, kind of ending with statin, and both agents, atorvastatin and rosuvastatin, they target the same enzyme, the HMG-CoA reductase. This enzyme, that's the early stage and also the rate limiting step in the biosynthetic pathway of cholesterol. So therefore, by blocking this enzyme, this would lower the production of cholesterol. Chemical structure, as mentioned, both statin agents, they have this carboxylic acid acidic motif. Therefore, both medications are given as the calcium salt form. So basically 2 molecule and then with the calcium, the salt form. For Lipitor, and also there is a trihydrates component. For rosuvastatin, this medication is also given as the calcium salt form. So 2 drug molecule with 1 calcium salt. As mentioned, both statins, they are synthetic and lipid-lowering statin agents. The dose range for atorvastatin is 10 to 80 milligram. For rosuvastatin, it's 5 to 40 milligram. And both statin agents, atorvastatin and rosuvastatin, they are high-intensity statin at higher doses. So for example, if 40 milligram above for atorvastatin, so they have the LDL reduction would be lower, for example, more than 45%. So basically, when taking at higher doses for Lipitor, like 40 milligram above, for rosuvastatin 20 milligram above, so they are high intensity statin. Half-life about 14 hours for atorvastatin, the parent drug molecule, about 20 to 30 hours for the equal potent metabolites. So that's the 4-hydroxy metabolites along with the 2-hydroxy metabolites. For Crestor, the half-life is about 19 hours. Collectively speaking, both statin, they are long half-life statin. So they have a long half-life for atorvastatin and rosuvastatin. So therefore, both statin, they are taking orally once daily. Also given their long half-life, so therefore they can be taken at any time of the day, with or without the food. Lipophilicity. The atorvastatin is more lipophilic with higher log P, 3.85. For rosuvastatin, it's more hydrophilic, log P is 0.89, lower log P. So given they have different lipophilic profile, so therefore the patients may tolerate one, not the other. And because of their different physiochemical properties, lipophilic profiles. So for example, if patients, if they cannot tolerate atorvastatin, they might be able to switch to rosuvastatin with better tolerability profiles. CYP for 50 and transporter interactions. For atorvastatin, it's a substrate of CYP3A4 and transporter protein for rosuvastatin is substrate for CYP2C9 and transporter protein. And with that said, you need to watch out the CYP3/4 inhibitors, inducers, and the transport inhibitors, all the drug-drug interactions. And so therefore you either try to avoid taking the drug together, or you have to lower the dose. Otherwise, this would increase the drug exposure for atorvastatin or rosuvastatin, and this can lead to the increased risk of myopathy and rhabdomyolysis. In some other cases, either avoid concomitant use, or you have to adjust the dosing. For example, do not exceed 20 mg or 40 mg atorvastatin daily. For rosuvastatin, either avoid concomitant use or have to make sure do not exceed 5 or 10 mg rosuvastatin daily, because this can increase the drug exposure and increase the risk of myopathy and rhabdomyolysis for atorvastatin and rosuvastatin. This is all the key references which I have used to prepare for today's video. Atorvastatin, the prescribing information, along with the rosuvastatin prescribing information, so that based on the latest version for the prescribing information documents. All the physicochemical properties are based on the chemspider.com. Finally, I want to thank you all so much for watching. If you enjoyed the video, please consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.